What's new in 50 years? What's new in 100 years? The equipment and procedures used for the treatment of hemorrhage in emergency field situations by most international military organizations and civilian medical services has remained unchanged for nearly 100 years. Now, the emergency bandage, a new first aid treatment device for the staunching of blood loss from traumatic hemorrhagic wounds in pre-hospital emergency situations. The emergency bandage is internationally patented, FDA approved for sale in the U.S. and CE marked for the European community. The product is designed with the end users in mind, the victim and the caregiver, sometimes one and the same. The design of the emergency bandage affords every possibility to bandage bleeding wounds on parts of the body that are normally difficult to bandage. For example, the groin or armpit. Direct pressure to the wound site is achieved by the wrapping of the elasticized woven leader over the top side of the emergency bandage pad, where the specially designed plastic pressure bar is situated. The pressure bar is designed to readily accept the wrapping leader. After engagement of the pressure bar, wrapping the leader in any direction around the limb or body part onto the pressure bar forces the pressure bar down onto the pad, creating the direct pressure needed to bring about homeostasis. Immediate direct pressure to the wound, stemming blood loss, may prevent the onset of shock. The elastic bandage also uses the rigid shape of the pressure bar to change direction while bandaging, giving more options for effective bandage placement. Subsequent wrappings of the leader secures and maintains the pad in place over the wound, and by covering all the edges of the pad, acts as a sterile secondary dressing, keeping the wound site free of dirt, grit, and additional infection. The closure system of the emergency bandage is multifunctional and yet simple, quick, and familiar. Situated at the end of the leader, the closure bar is designed with hooking clips at each end to secure the wrapping leader in much the same way that a pen is secured in a shirt pocket. The closure bar maintains the emergency bandage securely in place over the wound site. In cases of severe bleeding, the closure bar is used to exert additional direct pressure. Its design and rigid construction make it applicable to be used as the lever to create extra tension and compression. The closure bar is easily removed from its normal closure position and inserted in between previous revolutions of the wrapping leader, directly above the pressure bar and rotated. This rotation twists and tightens the wrapping leader, forcing the pressure bar down, compressing even further the pad onto the wound site. The hooking clips are used again to secure and maintain the pressure application. The emergency bandage provides efficient blood staunching capability by the application of immediate direct pressure to the wound site. A quick and easy method of application for the medical professional and the untrained layperson. The capability for self-application. The entire bandaging operation can be accomplished when acting alone, even if only using one hand. The emergency bandage consolidates the functions of numerous, currently separate pieces of treatment equipment into a single, easy-to-use unit. In emergency situations, when every second is crucial, the consolidation makes treatment more efficient, both medically and economically, providing significant time and cost savings. The consolidation affords more freedom to the caregiver. Focus and control in treatment are enhanced. First Care Products has developed the emergency bandage for introduction into the military and civilian first aid equipment markets. The emergency bandage is now replacing the traditional equipment used by the Medical Corps of Armed Forces, emergency medical services, law enforcement, and assemblers and distributors of first aid equipment for industry, transportation, and home. Better tools for soldiers make better soldiers. Better tools for medics make better medics. The emergency bandage has been designated to replace the current equipment carried by individual soldiers and every medic in the U.S. Army. For the non-medically trained combatant, the emergency bandage facilitates the treatment of hemorrhage by incorporating the functions of all the previous equipment into an ergonomically improved life-saving device, giving every soldier the ability to treat himself more effectively. The emergency bandage has been combat-proven with very positive results in Bosnia, Israel, Afghanistan, and currently in Iraq. A NATO reference number and U.S. national stock numbers, NSNs, have been assigned to all versions of the emergency bandage. the standard 4-inch personal dressing, the 6-inch Medix dressing, and the new 6-inch dressing with a second mobile pad used for entry and exit wounds. First Care Products chose only quality materials for the emergency bandage. The bandage conforms easily to anatomical irregularities, allowing greater freedom of movement with far less painful pulling than other bandages. The composition of the emergency bandage plastic elements enables the patient to be first X-rayed without interference, affording more information to the medical personnel before removal of the pressure dressing. Each emergency bandage is vacuum-packed in easy-to-open pouches. A tear notch is located at every corner, which provides immediate access. The packaging guarantees the bandage's 100% sterility. In emergency situations, where injury is a result of external trauma, bandages are among the first equipment used. The emergency bandage is an ideal product as an integral part of first aid kits for cars, home, and industry. As the number of cars on the road increases, so do the accidents. For most motor vehicle crashes, the nearest available person will be a layperson, the victim, or a bystander. People must be increasingly prepared to treat themselves in case of injury. First Care Products has begun sales to and established marketing contacts in the U.S., England, Israel, Belgium, France, Holland, Italy, Germany, Austria, Switzerland, Spain, Greece, Turkey, and the Far East. The emergency bandage is becoming the standard trauma wound dressing for emergency medicine throughout the world.